Which cranial nerve has the longest intracranial course? The correct answer is B. Trochlea nerve. The trochlea nerve CN Roman 4 has the longest intracranial course of all cranial nerves. The radial artery can be palpated, where most easily. The correct answer is B. Anatomical snuffbox. The radial artery lies superficial in the anatomical snuffbox on the dorsal hand. What is the anatomical landmark for a lumbar puncture? The correct answer is D. L4, L5. A lumbar puncture is typically performed between L4, L5, below the canus medullaris. Which bone forms the majority of the hard palate? The correct answer is A. Maxilla. The palatine process of the maxilla makes up most of the hard palate. Which nerve innervates the anterior compartment of the arm? The correct answer is C. Musculocutaneous nerve. The musculocutaneous nerve supplies the biceps brachii, brachialis, and coracobrachialis. What structure lies within the intervertebral foramen? The correct answer is C. Spinal nerve. Spinal nerves exit the vertebral canal via the intervertebral foramen. Which vein drains into the axillary vein? The correct answer is A. Cephalic vein. The cephalic vein drains into the axillary vein near the deltoidal groove. Which muscle is the chief extensor of the hip joint? The correct answer is C. Gluteus maximus. The gluteus maximus is the main extensor of the hip, especially when rising from sitting. What nerve innervates the intrinsic muscles of the larynx except cricothyroid? The correct answer is C. Recurrent laryngeal nerve. The recurrent laryngeal nerve innervates all intrinsic laryngeal muscles except cricothyroid. Which structure passes through the esophageal hiatus of the diaphragm? The correct answer is C. Esophagus. The esophagus passes through the esophageal hiatus at the T10 vertebral level. Which structure is located in the posterior mediastinum? The correct answer is C. Descending aorta. The descending aorta is a key structure in the posterior mediastinum. What is the sensory innervation of the palmar surface of the thumb? The correct answer is C. Median nerve. The median nerve provides sensory innervation to the palmar thumb and lateral fingers. Which ligament connects the liver to the anterior abdominal wall? The correct answer is A. Falciform ligament. The falciform ligament connects the liver to the anterior abdominal wall. Which structure is found in the femoral sheath? The correct answer is B. Femoral artery. The femoral sheath contains the femoral artery, vein, and canal, not the nerve. Which muscle is innervated by the long thoracic nerve? The correct answer is C. Serratus anterior. The serratus anterior is innervated by the long thoracic nerve. Which part of the pancreas is located within the curve of the duodenum? The correct answer is D. Head. The head of the pancreas lies in the C-shaped curve of the duodenum. What is the primary function of the rotator cuff muscles? The correct answer is B. Stabilize the glenohumeral joint. The rotator cuff muscles stabilize the glenohumeral shoulder joint. Which nerve passes through the Obturator Canal? The correct answer is C. Obturator nerve. The obturator nerve passes through the Obturator Canal to enter the thigh. What structure separates the true and false pelvis? The correct answer is A. Pelvic brim. The pelvic brim marks the boundary between the true and false pelvis. Which artery supplies the midgut? The correct answer is B. Superior mesenteric artery. The superior mesenteric artery supplies the midgut structures. Which structure is anterior to the epiglottis? The correct answer is A. Hyoid bone. The hyoid bone lies anterior to the epiglottis and helps anchor it. Which muscle forms the floor of the posterior triangle of the neck? The correct answer is E. Scalenes. The scalene muscles form the floor of the posterior triangle. Which part of the urethra is most prone to injury in males? The correct answer is B. Membranous urethra. The membranous urethra is vulnerable during pelvic fractures due to its fixed position. Which muscle is pierced by the parotid duct? The correct answer is A. Buccinator. The parotid duct pierces the buccinator muscle to enter the oral cavity. What structure connects the hypothalamus to the pituitary gland? The correct answer is C. Infundibulum. The infundibulum connects the hypothalamus to the pituitary gland. The coronary sinus drains into which heart chamber? The correct answer is A. Right atrium. The coronary sinus drains deoxygenated blood from the heart into the right atrium. Which structure is located within the cavernous sinus? The correct answer is C. Abducens nerve. The abducens nerve CNVI runs through the cavernous sinus. What is the innervation of the posterior compartment of the thigh? The correct answer is C. Sciatic nerve. The sciatic nerve innervates the posterior compartment of the thigh. Which artery is a branch of the external carotid artery? The correct answer is C. Superior thyroid artery. The superior thyroid artery is a branch of the external carotid artery. Which muscle is responsible for flexion of the forearm at the elbow? The correct answer is A. Biceps brachii. The biceps brachii is the primary flexor of the forearm at the elbow. Which structure is found within the carotid sheath? The correct answer is B. Vagus nerve. The carotid sheath contains the common carotid artery, internal jugular vein, and vagus nerve. Which part of the brain is responsible for coordination and balance? The correct answer is D. Cerebellum. The cerebellum coordinates voluntary movements and maintains balance and posture. The thoracic duct drains into which venous structure? The correct answer is B. Left subclavian vein. The thoracic duct empties into the junction of the left subclavian and internal jugular veins. Damage to the radial nerve at the midshaft of the humerus results in. The correct answer is B. Wrist drop. Radial nerve injury at the humeral shaft leads to wrist drop due to extensor muscle paralysis. What is the function of the serratus anterior muscle? The correct answer is C. Protract the scapula. The serratus anterior protracts and holds the scapula against the thoracic wall. Which bone contains the sellar turcica? The correct answer is C. Sphenoid bone. The sellar turcica, which houses the pituitary gland, is a depression in the sphenoid bone.
Ace your medical exams. Study smarter with Scrolls MD. Scrolls MD is your all-in-one app for medical students and doctors worldwide. Dive into thousands of high-yield MCQs with detailed explanations, smart flashcards using active recall and spaced repetition, plus condensed notes and full-length mock exams. Prep for USMLE, PLAB, and CCQE, AMC CAT, NEET-PG, and more. Import Anki decks, track your progress, focus on weak areas, and study offline with dark mode. Thousands trust Scrolls MD to build mastery and crush their exams. Download now and study smarter with Scrolls MD.